Good afternoon, I'm Nina Arbalicanta, and our thesis is entitled Effectiveness of Calamansi or Citrus microcarpa against Staphylococcus aureus and Escherichia coli as a hand sanitizing agent. Our hands carry out hundreds of tasks every day, from taking out garbage to greeting new people, from holding doors for others to shaking hands with new people. Really, our hands perform a variety of roles. Unfortunately, hands also carry a plethora of germs that, if present in large amount, can deliver diseases and illnesses. The hand is the most consistent residences of germs in a person's body. It carries hundreds, if not thousands, of bacteria that can alter our normal life in an instant. Germs lurk everywhere. Our awareness of their presence is diminished by their invisibleness. We can't deny the fact that it is impossible to avoid all bacteria, but constant cleaning of hands surely will prevent the spread of germs that cause illnesses and diseases. Some hospital-acquired pathogens are transmitted from patient to patient via the hands of healthcare workers. Hand washing is the simplest and proven most effective method to reduce the incidence of nosocomial infections. Hand washing is a very important thing to remember in keeping us safe from infections. It is one of the most basic preventive methods that can be practiced to keep us away from Staphylococcus aureus and Escherichia coli, as they are repeatedly associated with nosocomial infections. The researchers chose the topic of hand washing primarily because it is basic. And since water and soap are not always available, a homemade ingredient of hand sanitizer popped out of the mind of the researchers, which is available, low cost, there is a reduced risk for allergic reaction, it is proven to be applicable in the skin, and most importantly, it has antibacterial property. The question in primacy was regardful of calamansi being an alternative yet a more effective and cost-friendly antiseptic in comparison with other commercially prepared hand sanitizer like isopropyl alcohol 70%, alcohol-based hand sanitizer, betadine solution, stearinlum, and distilled water. The investigation of the antibacterial property of calamansi or citrus microcarpa and other commercial agents, its comparison with other commercial agents, its utility as a hand sanitizer against specific bacteria are the main focus of the study. Specifically, it answers the following inquiries. First, how do the calamansi preparations such as the calamansi juice extracts, the calamansi peel extracts, the calamansi juice sanitizer, the calamansi peel sanitizer, and the combined calamansi peel sanitizer compare to the commercially prepared antibacterial solutions such as the isopropyl alcohol 70%, alcohol sanitizer, betadine, stearinlum, and distilled water in inhibiting Staphylococcus aureus and Escherichia coli. Second, which of these different calamansi preparations is the most effective in inhibiting the growth of Staphylococcus aureus and Escherichia coli? Third, how is the most effective calamansi sanitizer among the calamansi juice sanitizer, the calamansi peel sanitizer, and the combined calamansi peel and juice sanitizer, and the commercial alcohol sanitizer's antibacterial property contrast when used in human hands? Fourth, how is the calamansi prepared as a sanitizer to achieve its optimum antibacterial effects? The input included the calamansi plant, specifically the juice and the peel, and the other inputs included the isopropyl alcohol 70%, alcohol-based sanitizer, betadine, stearinlum, and the distilled water. For the process, we did an experiment regarding first the comparison of the effects of the different agents in killing Staphylococcus aureus and Escherichia coli and their antimicrobial property. Second is the comparison of the best hand sanitizer, which is our product, and compared to the alcohol-based sanitizer. The output was to analyze the effectiveness of the different agents of the calamansi against the alcohol-based sanitizer. First, there was collection of calamansi, and after that there was preparation of those calamansi. The juice and the peel were taken from the calamansi, and extracts from the juice and the peel were taken. And then an emulsifier was added to this extract to make the sanitizer. The sanitizer was divided into three. First, the juice sanitizer, and then the combined juice and peel sanitizer, and the peel sanitizer. Those 3 sanitizers were subjected to instrumental analysis, and the second one is for the screening of antibacterial property against Staph and E. coli. First is the summary graph for effects of calamansi against Staphylococcus aureus. As we can see here, the calamansi juice is the most effective, having a mean of more than 15, and the next is the calamansi juice sanitizer, and thirdly, the calamansi juice and pill sanitizer. And the calamansi pill sanitizer and calamansi pill did not exhibit any effects against Staphylococcus aureus. Figure 4.4 on the other hand is a summary graph for effects of calamansi agents and Escherichia coli. The most effective is the calamansi juice sanitizer, followed by the calamansi juice extract, thirdly followed by the calamansi juice and pill sanitizer, and then lastly by the calamansi pill. The calamansi pill sanitizer, on the other hand, had no effect on Escherichia coli. Figure 4.5 is a summary graph of the effects of calamansi juice sanitizer and commercial sanitizers to Staphylococcus aureus. As we can see here, the calamansi juice sanitizer exhibited a zone of inhibition of more than 15, while the commercial hand sanitizer exhibited less than 7 as a mean of zone of inhibition. Figure 4.6 is a summary graph of the effects of the commercially prepared hand sanitizer and the calamansi juice hand sanitizer against Escherichia coli. As we can see here, the commercially prepared hand sanitizer exhibited no effect against E. coli, and the calamansi juice sanitizer exhibited a mean of 16, more than 16 for the diffusion. Figure 4.8 is the comparison of means of the difference between the pre-test and the post-test absorbance readings of calamansi juice hand sanitizer. In the pre-test, there was a mean of 0.15, and in the post-test, we can see that there is a mean of less than 0.5. All the calamansi solutions, except for the pill solutions, were more effective in Staphylococcus aureus than in Escherichia coli. Calamansi juice and calamansi juice sanitizer have been most effective against S. aureus and E. coli, followed by the calamansi juice and pill sanitizer. Calamansi juice was more effective than the calamansi pill. Calamansi juice sanitizer, being the most effective against Staphylococcus aureus and Escherichia coli compared to the commercial alcohol sanitizer, has better inhibition of Staph and E. coli according to the diffusion. The best way to prepare calamansi juice as a sanitizer is to follow the ratio of 1 ml distilled water is to 2 ml of calamansi juice is to 0.0 grams of gelatin, since the ratio 1:2 between distilled water and calamansi juice has been effective according to the diffusion, while its consistency to the hand sanitizer. I recommend the testing of antibacterial property of the other parts of calamansi. Also, the testing of antimicrobial property of calamansi against broad-spectrum bacteria such as Mycobacterium, Klebsiella, Pseudomonas, Haemophilus, and others. I also recommend the use of other emulsifiers to improve the sanitizer's consistency and to lessen the sticky effects on the hands and improving the shelf life of the sanitizer without affecting the effectiveness of calamansi as an antimicrobial agent. I also recommend the use of other fruits that have similar antimicrobial property with calamansi, such as guava, papaya, kamias, and many other more. It is also highly recommended to seek other methods like pour plate method for equal distribution of bacteria. On behalf of Group 5 of 4NU2, I'm Nina R. Balicanta, Batch Eximius. Thank you for listening and have a great day.